Understanding appendicitis. A pain in the abdomen. Appendicitis is a common medical condition. It affects the appendix, a small, finger-shaped pouch connected to the large intestine. This condition causes inflammation and pain, and requires immediate medical attention. Appendicitis is a relatively common condition affecting millions worldwide each year. It can occur at any age but is most prevalent between the ages of 10 and 30. Early diagnosis and treatment are crucial to prevent complications and ensure a smooth recovery. The appendix is a vestigial organ. It's a small, narrow pouch located in the lower right abdomen. While its exact function remains unclear, it is thought to play a role in the immune system. Because of the narrow lumen, the appendix is susceptible to obstruction. Appendicitis occurs when the appendix becomes blocked, often by fecal matter, foreign objects, or even tumors. As the appendix becomes blocked, bacteria naturally present in the gut begin to multiply rapidly. This blockage leads to inflammation and swelling, hence called acute appendicitis. The inflammation also irritates the lining of the abdomen, leading to the characteristic pain associated with appendicitis. If the blockage is not relieved, the appendix can continue to swell, compromising the blood flow to the appendix, making it necrotic, further aggravating the situation. If left untreated, the appendix can rupture, spreading infection throughout the abdomen. This is a serious complication known as peritonitis. Recognizing the symptoms of appendicitis is crucial for early diagnosis and treatment. The most common symptom is pain in the lower right abdomen. This pain typically starts around the belly button and gradually moves to the lower right side. The pain is usually constant and worsens over time. It may be worse when moving, coughing, or taking deep breaths. Other common symptoms include loss of appetite, nausea, vomiting, and a low-grade fever. In infants and young children, the symptoms of appendicitis can be less specific. Infants may be fussy, refuse to feed, and have a distended abdomen. Young children may have difficulty describing their pain, making it challenging to diagnose appendicitis in this age group. Older adults may also experience less intense pain and fewer symptoms, making diagnosis more difficult. It is important to note that the location and intensity of pain can vary depending on the individual and the position of the appendix. Prompt action is key seeking medical attention for appendicitis. Delaying treatment can increase the risk of complications, including rupture of the appendix. When you arrive at the hospital, a doctor will examine you and ask about your symptoms. They will press on your abdomen to check for tenderness and may perform a rectal exam to rule out other conditions. Blood tests will likely be ordered to check for signs of infection, and a urine test may be done to rule out a urinary tract infection and pregnancy in childbearing aged women. Imaging tests, such as an ultrasound or CT scan, are often used to confirm the diagnosis. These tests show inflammation of the appendix and any blockage or rupture. Timely treatment and intervention. Upon confirming appendicitis, antibiotics should be promptly started to avoid the spread of infection. Although definitive treatment is the removal of appendix through surgical intervention, minimal invasive surgery called laparoscopy is performed under general anesthesia, and the appendix is removed through one of the small holes made by the surgeon. But in case of complications, the surgeon sometimes has to elongate the incision, which is called laparotomy. In case of appendix with abscess, surgery is not always feasible. In that case, a radiologist will drain the abscess with the help of ultrasound. Therefore, early diagnosis and treatment are crucial to prevent complications and ensure a smooth recovery.